Alprazolam, with the trade name Xanax, belongs to a benzodiazepine pharmacological class of medication, which is used for the treatment of generalized anxiety disorder and panic disorder. This drug is rapidly absorbed and has a relatively brief duration of action. Alprazolam can cause various central nervous system-related side effects, including drowsiness, fatigue, decreased alertness, and confusion. In addition, alprazolam has been shown to cause ataxia and memory impairment. Alprazolam and memory impairment. One of the clinically significant adverse reactions of alprazolam is memory impairment, which is called anterograde amnesia. According to the American Psychological Association, anterograde memory is defined the ability to retain events, experiences, and other information following a particular point in time. Alprazolam can impair anterograde memory, causing anterograde amnesia, which is a short-term state of becoming very difficult or even impossible for individuals to recall what happened after drug administration. Onset of alprazolam-induced anterograde amnesia. The onset of anterograde amnesia is rapid. However, tolerance to this effect appears to develop during chronic use of alprazolam. Duration of anterograde amnesia. Anterograde amnesia occurs rapidly after administration of alprazolam, and the duration is usually limited to a window of 90 minutes following each dose administration. There are several risk factors associated with a higher propensity for alprazolam-induced amnesia side effects. These risk factors include administration of higher doses, administration of alprazolam in patients with kidney impairment or altered kidney function. In patients with kidney impairment or altered kidney function, reductions in renal function impair the renal excretion of alprazolam and its metabolites, leading to accumulation and increased risks of toxicity and adverse effects, including anterograde amnesia. Therefore, it is essential to adjust the alprazolam dose in patients with creatinine clearance below 10 ml per minute or patients on hemodialysis. To understand how alprazolam induces anterograde amnesia, we must first understand the mechanism of action of alprazolam. Alprazolam exerts its effect by binding to stereospecific benzodiazepine receptors on gamma-aminobutyric acid A receptor, which is the chief inhibitory neurotransmitter of the central nervous system. This binding enhances the inhibitory effect of GABA and resulting increased neuronal membrane permeability to chloride ions, leading to the frequency of the flow of chloride ions through the GABA ion channel. This shift causes postsynaptic hyperpolarization, a less excitable state, and consequently a decreased ability to initiate an action potential, inhibitory effect and stabilization. As you can see in an image, the GABA-A receptor complex is composed of 5 subunits, each with multiple isoforms. Multiple forms of alpha, beta, and gamma subunits are arranged in different pentameric combinations so that GABA-A receptors exhibit molecular heterogeneity. There is a hypothesis that binding of alprazolam to the benzodiazepine receptor type, containing the alpha-1 subunit isoform, which is highly concentrated in the cortex, thalamus, and cerebellum, is responsible for alprazolam-associated anterograde amnesia. Thanks for watching. If you found this helpful, hit the like button and please subscribe to get future video lessons.